My name is Jonah Pell. I'm here with my colleague, Emily McCray, and we are with the Center for Health Innovations New Mexico Community Data Collaborative. We're the ones who developed the data dashboards for the health councils. And so we want to do a brief refresher on how to use the data dashboards. It's a ton of stuff. It gets really confusing. So we're here and happy to help. Hopefully this will be a good kind of revisit for some of this stuff and an introduction for those of you who haven't seen it yet. And it's going to be mainly my colleague Emily McCray presenting. She's going to be taking over for me in a couple weeks. I'm going to be going on maternity leave, so she's going to be the interim director of the department, and she's fabulous at these trainings. So with that said, I will leave it to Emily.
Okay, hi everybody. My name is Emily McCray. I'm the Center for Health Innovations Data Specialist. And as Joan said, I worked on putting together the dashboards and the health profiles. And yeah, today we're just going to go through the San Juan County dashboard and provide a little refresher on navigating the content in the Health Council dashboard and interpreting the data. I understand that there's other people from other health councils today. So while we are looking at San Juan County's dashboard, it should all be applicable to everybody's dashboard. And I will specify if there's some special consideration throughout. But for the most part, just assume that everything with San Juan's dashboard is going to be the same for your dashboard. Okay. And yeah, like Amanda said, this is a recorded session, so this will be uploaded as a resource to reference later. And I'm just going to go ahead into a screen share. Okay. And is everyone seeing my screen okay? The mouse moving around? Okay. Okay, so this is a table of links to the data dashboards and health profiles for all the 39 participating health councils. Links to tribal council data products are not currently made public. The products will be made publicly available should the tribal health council leadership request that. Otherwise, if you are from one of those, I think 9 or 10 tribal health councils, and you don't have access for whatever reason, you should have access at this point to your data products. If you don't, please reach out and we will help you get access to that. The first column is going to be your health council's name. The next column is a link to your health profile. That's the PDF document. The next column is your COVID specific dashboard link. And then the last column is the full dashboard. It includes COVID data. The reason to access the COVID specific dashboard as opposed to linking it through the full dashboard would be that the full dashboard has a lot of content. And so if you are just trying to get your COVID data, this will load faster. So you can open your URL. I've already got it open here in a new tab. So I want to just start with walking through the COVID tab first and kind of getting in more detail on how to interpret all this COVID data. And then in doing so, we can then move on to the other tabs, but a lot of what we talk about will be useful in understanding and navigating things in the rest of the tabs. Okay, so let's go from left to right. So the overall numbers here are vaccination numbers. This panel here is all vaccination numbers. So this is the total number of people fully vaccinated in the county. This is the percent of the total population that is fully vaccinated. And this is a table with detailed information on vaccination by population, ages, and vaccine status. So 1 dose, fully vaccinated, and then there's booster information as well. And this is all updated 3 times a week, actually. Yeah, so we've processed this data, this vaccine data, And we update this 3 times a week. It's Monday, Wednesday, and Friday. So moving along, okay, I'll pause. Does anyone have any questions so far on the COVID vaccine data? Okay. And please feel free to ask questions along the way, post your questions in the chat. I'd be happy to stop and answer any questions along the way. So if there are no questions, we can move along to the maps. And before I get too far into the maps, I do want to point out that if you hover over any of these boxes, you hover your mouse, this little icon appears, and that's like a maximize window button that appears anytime you hover over a box. So I know that depending on your screen size, this might look very different. And so you would want to maximize those windows, and then you'll be able to view it a lot better. So I'm going to go ahead and do that. And just looking at this map, so I'm seeing a title, vaccine hesitancy by zip codes and vaccine locations. It's got some little squares, some are red, blue, various colored little squares, some yellow lines, some red outlines, and then some various shades of brown. So if you want to know what that means, this is actually a legend icon. If you click this button, that'll just tell you what everything is. So always open that, that's your legend. So from here, we can see that those little squares indicate vaccine program sites. Now this is vaccine children sites, but a lot of them do adults as well. And the color indicates the type of practice that it is. So if we go, we can zoom into San Juan County, and I think I forgot to mention this, but every map that you open will be defaulted to your county or your tribal area. It will be zoomed right into your area. So we see some red squares, so that indicates it's a private practice. Some purple, it's a tribal or IHS clinic. You can click right on those squares and you will get a pop-up that will give you the name. It will give you more information on that feature. So for a point like this, a point feature, it's giving us the name, some contact information, and the address. You might also see up here, notice up here, there's an arrow, 1 of 2. That means that the map wasn't sure what you were trying to click on. There's multiple things being displayed, so it wasn't sure if I was trying to click on that practice or if I was trying to click on a zip code. And I'll come back to this in just a minute. I just want to keep moving right down the legend. So we saw our yellow lines, that's indicating tribal boundaries. Our kind of reddish lines, that's your county boundary. I know some health councils weren't recognizing just like the outline of their county. So if that happens to be you, this red outline will outline your county and you will have a label so that it will label it right there. And then the last item on this map, or the main feature of the map, really is the vaccine hesitancy rate. So the darker the color basically is indicating that you have a higher percent hesitant, a higher percent of your population that express hesitancy in getting the COVID vaccine. And if the color gets lighter, then you had a lower percent hesitant. And if, I know we had some questions on what that meant as well. If you click on a zip code, these are zip codes as indicated here, you will get a pop-up. And previously we were not updating this layer regularly, but we are at this point updating this vaccine hesitancy weekly. And so it will be representative of the most recent week where there is available data. In this case, it was January 20th to the 26th. So this is a question asked, it's a survey that goes out, and it asks if a COVID vaccine, if a vaccine to prevent COVID-19 were offered to you today, would you get vaccinated? So in this zip code, 6.94% expressed any hesitancy, and that includes saying no, but it also includes saying yes, probably, and that's because the word probably entails some doubt in your mind. So for this survey, it's counting that as being hesitant. And if you have more questions, you can copy this URL and put that in your browser, and you'll get more information on that. Okay. So does anyone have any questions on this vaccine hesitancy zip code map? Okay. Okay, and then also down here, there are some links to external resources for information on the COVID vaccine in educational materials. I'll keep moving on through the maps if we don't have any questions. So this is a map of COVID cases versus deaths. This is updated daily. This data, I believe, comes from the Johns Hopkins dashboard, and it's updated daily. Again, we just want to open the legend, and that'll show you what's going on here. So this one's a little bit confusing, and we've had questions on how to interpret this legend. So it's COVID cases versus deaths per 100,000 updated daily. So it's a case rate, it's comparing two different indicators, COVID cases and COVID deaths. And basically, the arrow that's pointing to the right corresponds with COVID deaths, the COVID death rate, and then the arrow that's pointing to the left corresponds with cases. So if you have, for example, in San Juan, it's purple. It looks more like this shade of purple right here. It's saying that both cases and death rate were high. If we go next door to Rio Arriba, it looks more blue. That's saying that cases were high, but deaths were comparatively low. We go down here to Los Alamos. Both cases and deaths were kind of equally low. And then again, there's always going to be a pop-up. So you can click the pop-up. Again, we're getting the 1 of 2. This is just highlighting that tribal area and telling us what it is. If we click the arrow, we'll get to the pop-up for our cases, and then you'll see detailed information here. Okay, so I'll go on to the next map, which is the SBI the cases versus SBI map. Again, we're defaulted right here to San Juan County. Whatever your area is, you will be zoomed right into that area. So if we open the legend again, we'll see what's going on here. So blue dots, the percent of people ages 5 and up who are fully vaccinated. So if the blue dot gets larger, you have a higher vaccination rate. And if it's lower, you have a lower vaccination rate. And then if you scroll down, the social vulnerability, at this point, you're probably familiar with social vulnerability, the social vulnerability index. If you are not, it's an index score that takes a series of indicators related to socioeconomic outcomes, minority status, housing and transportation, and household composition, and puts that all together to kind of gauge a community's ability to be resilient or to respond to a natural disaster. So it's giving it sort of like a grade score here. So, and this index is going to be compared to the US. It's just that we're seeing it for New Mexico. So compared to the US, we'll see what grade that community is. And there's going to be another pop-up, of course, with information. This looks like some more detailed vaccine information. So we can move on to the cases versus vaccines. This has 2 maps. side by side. And this is just sort of to visually compare your recent active cases, it's updated daily, to your vaccination rate. And this is from that data set that's updated on Monday, Wednesday, and Friday. So these are both recent. So pretty much if you have more, if you're in an orange color, you have higher cases, and yellow is sort of in the middle, and green, you have fewer cases. And then you can compare that to your vaccinations. If you have green, you've got a higher vaccine rate, orange, a lower vaccine rate. And there's pop-ups on these as well. Do we have a question? Okay, I'll keep going. If anyone has a question, please go ahead and just interrupt me or put it in the chat. And so the last map that we have on here, and this was sort of a recent addition. This is the New Mexico Vaccine Equity and Rebuild Network Programs and Contacts. And let's open the legend to see what this is. So there's little circles and they're varying sizes and varying colors. The color just indicates the type of region. Most of them are counties. And then there's blue is health region, and there's two greens, and it just says other. The other is, this one's the state. There's really only two others. So this one's for New Mexico. The other one's for the city of Albuquerque. And then if you have a larger circle, it indicates you have more programs. Smaller means you have fewer programs. So if we go over here and we look at this pop-up, we can see there's a pie chart, and right away we don't understand what's going on the pie chart. You have to hover your mouse and then it will tell you what's going on. So these are focus categories, and it will show you in parentheses. It says 7, there's 7 programs, or almost 44% of them that had a focus area of communications. And then you can go around and see what else. And then if you click the arrow, oftentimes these graphs in the pop-up will have arrows. That means there's another graph that you need to go and click and see. This one's population served. So again, just hover and you will see 4 served immigrant refugee populations, and so on. Now you're seeing 7, so this says 7 and there's 7 programs. They can have more than one population that they serve, and they can have more than one focus area. And then if you click here, the word here is a hyperlink, and it will actually open an image that has a full list of the programs that are operating there. So it's got the name, the contact information, and then those focus areas and the audience, and you can see there's multiple audiences listed. Okay, so that's all the maps. And we can just minimize that screen now. Did anyone have any questions on the maps? Okay, if there's no questions on the maps, I will keep going. Okay, so the next section is showing COVID cases by demographics. This is recent data. This is showing cumulative cases from January of 2020 to December of 2021. And we're updating this monthly. I know it's December, but we are updating it monthly, and that's just the most up-to-date that it is online. Okay. And so these are graphs of COVID demographics by race. It's a rate per 100,000 population. And if you hover over that population, it will give you the number. So for instance, here, we're seeing that the COVID case rate for Native Americans was the highest, and followed by white non-Hispanic at 11.4, and then Hispanic at 8.4. We have COVID cases by age. Now these are showing us the counts. And again, you just hover and it will give you those breakouts with the number, and it's calculating a percent as well. And the same thing for by sex. So hover, again, you get the count of cases and a percent of the total. Note there is an unknown age and an unknown sex. I'll jump down here to our COVID trends. And you can expand this, but I want to point out, if you scroll down, you'll see some text down here, and this is helpful. This is telling you what we're looking at. So we're looking at a change in COVID cases from April of 2021 to December 2021. This is all cases. And this is also being updated monthly. So you can see while it's December as the most recent month, we did update it just a few days ago. So we are keeping it up to date. This is CDC data. This demographics and this line graph are CDC data. So if you hover over the graph with your mouse, you'll get a pop-up that will tell you, it says the ninth most recent month, and then 894. 894 is the number of cases that occurred in that month, and that was April. So as we move along, you will see the change. It dipped down and then it goes up and it spikes over here. And I think this is November. So it's probably around the holidays. This trend is available for all of these demographics. So you just click this arrow and it will take you through. Here's ages 0 to 17. Note that the graph is being normalized to the range of values in that category. So for instance, this goes up to 1,000. This goes up to 1,500. So just keep that in mind. But yeah, we've got this for ages 0 to 17, 18 to 49, and so on. For each of the different races. There. Okay, and this is updated monthly. And you will see the date it was updated. This gets auto-updated as well as the state range. So you'll know what range you're looking at, what the first most recent month is, etc. Okay, and now prevalence of chronic disease is the next feature listed here, or feature on this dashboard. So this is just a static number. These don't change. They're not being updated on the update frequency as this COVID data, but this just shows you the prevalence of these conditions in your community. Okay, and then on our far right side, we have data that comes from the Johns Hopkins data, and this is all updated daily. So the far right side is updated daily. So we have our COVID status with active cases, mortality rate, all-time cases, all-time deaths, and then your inpatient COVID capacity. So we had 172 would be the max capacity, and it looks like there's about 49 people there now. And then the last feature here is a link to some external resources. So you could follow this link here and get some more COVID data. And that is all of the features on our COVID dashboard. Again, this is updated 3 times a week. This is updated monthly. This is updated daily. Do we have any questions at this point?
Yeah, Emily, I have one if I could.
Yeah.
So my name is Nicole Clark and I work for Basin Health Companies here in town. Thank you for your presentation. So my question is, did one of your graphs, I didn't see it or hear you say it, but does any of your data reflect patients with underlying conditions, otherwise known as comorbidities?
No, we don't have our COVID data broken out with that level of detail.
Okay, I was just curious because of course that is the population that we usually deal with, are people with those underlying conditions. So I didn't know, how that would play into the data. So,
Yeah. Yeah, thank you for that feedback. What we have now, this is sort of our proxy, is just kind of understanding a baseline of where the community is at, but we are taking feedback like that. A lot of this, the data that we do have, we added because of feedback, people saying what would be most useful for them. So that can be something that we keep an eye out for if we come across that.
okay, thank you.
Do you have any other questions or comments? Okay, if there are no other questions, I will move on to the next tab in the dashboard, which is the Equity and Priorities tab. And I can move through this section a little faster than we did the COVID one. I wanted to give a detailed overview of everything in the COVID section of the dashboard. However, most of the navigation tips that we went over there will apply to the features in this equity and priority section. A main thing that I want to point out though is that in this, the equity and priorities, we do have a lot more sub-county data available. For instance, it says county census tract here. That's just due to availability of sub-county data. So since we're working with a lot of different equity indicators here, there's a higher availability for sub-county data. Okay, and this features your Health Council priorities. So everyone has these tabs. Before I get too far, I do want to go back to the COVID tab and mention that the demographic data is available for 18 counties. I don't know why it's not available for all of the counties in the state. We get that from the CDC, and if it becomes available for any other counties, we will immediately put that up. But for the time being, it's only there for 18 New Mexico counties. If you are one of those counties that does not have the specific COVID demographic data, you will have a proxy. Your screen might look a little bit different. You'll have New Mexico, or rather it's the 18 counties rates for those different demographic groups, and then your population. So you can kind of use that as a proxy. Okay. And then unfortunately we can't do a trend as a result of that. Okay, so generally on this dashboard, we see a lot of the same kind of things. There's bar graphs, there's pie charts, there's a map. We have these standalone numbers, or you could say call out numbers. The main point I want to make with these is that it's county. If it's a county number, you will see it. Everything is labeled. So for instance, this says San Juan County, San Juan County. That's the county. It's a specific county number. If it says county census tracts, that is taking the highest value across all of the census tracts that appear in your county or tribal area. If you click this little arrow, you'll get a pane that comes out, and it has some more information, some more navigation tips. And then it also kind of elaborates more on that. So what is county? What is the county census tracts? In this case, it looks like there were 33 tracts, census tracts in San Juan County. Okay. So again, you just hover and you will get a number and more details to understand these graphs. Same thing with the pie charts. You hover and you will get information. And everything should have a year, so you know what year it is and what the indicator is saying. And so you'll have a map, the same thing as what we were doing in the COVID tab. If you click, you'll get a pop-up with information. It'll highlight the area that you clicked. I don't know if I mentioned that before, but yeah, you'll see the area outlined. So in this case, it's census tracts. Census tracts. We're looking at the race or ethnic group which made the highest median income in that census tract. So if we see this, that it's like a more of a brown color, that indicates that it was white, non-Hispanic households that were making the highest median income, and so on. And then if we see that this color is maybe a little darker brown compared to a lighter brown, it's indicating the strength of that. The how much did they make a lot more than everyone else, or they made a little bit more? And we'll look at another map that uses the strength of prominence that might illustrate it a little better. So I just kind of want to hop around on here to a couple tabs that I think are gonna kind of throw maybe a couple curveballs or just stuff we haven't looked at already. The first one is in the early childhood tab. This just uses neighborhoods. It says neighborhoods. These are small area neighborhoods, and you might have a handful of them in your county. This looks like there's 5. These are small area neighborhoods. So that's just a little different than seeing a zip code or a census tract. It's just another type of boundary to put data in. And then the other one that I want to focus on is this community safety tab. Within this tab, and I believe the built environment, I think too, we see this current map extent. This means that the data you're seeing is reflecting the current map extent. In this case, it's this map. This is a crime index, and this is a crime index. And the same thing for this hate crime data, it's current map extent. So if you pan around the map or zoom in and out, you'll see these pie charts and this bar graph change. It's changing to reflect the area of the map that's in the pane, that's in this map window. This is a map that I was saying we can see the strength of prominence a little better. So this is showing us crime in census blocks, the crime index. It's saying if you had more personal crime than property crime, you will get a red dot. If you had more property crime than personal crime, you'll get a blue dot. And then if you had, let's go right over here. This illustrates it very well. If you had a lot more personal crime than property crime, you have a very strong red dot. If it's not quite so much more, it's very faint. See, it's almost hard to see. The same thing for property crime. If you had a little more property crime than personal crime, you get a faint blue dot. That's what the strength of prominence is saying. And we did have some questions about how to interpret this crime index. The crime index is a value that's based off of a national average. So the national average is a baseline of 100. So if you hover, you will get a number. So if we hover here, we see 331. So this was a total crime index of 331. That means that it was 231 above the US. And if we go and zoom around, we can find an area that has a number under 100. I think I found some over in Los Alamos. So if we zoom in here, for instance, and then we hover, we'll see 19, for instance. So that means that it was under the US baseline. So that's how you read this crime index. And we're at about 3:40. I think we had about an hour to go through this and then open it for questions. But then of course, if you have any questions now, please go ahead. I'll go ahead and move into these other two tabs. So this is the recovery tab, and this is information on resources and information on health topics that have increased or that we know have increased as a result of COVID. So things like mental health, substance use, domestic violence, and things like that. This is has data on that. And these are resources basically over here. So clinics, SNAP retailers, lots of different resources and information on different protective factors. You can click through these. This is the same, navigation as everything else. If you hover, you will get that. That number will pop up for you. Same thing here. I hover and we're seeing what occupation, what percentage of workers. So looks like 19% work in service. And then here's some information on government grants in the area. And these are also hyperlinked, so you can go directly to this source where we found this. And then our last tab is local updates. So what we have in here right now will vary depending on your health council. We put, for a lot of the health councils, we put their website, but this is really meant to be a place for you to list relevant documents, anything you want to link to have right there ready to access for your health council. Okay, so that covers our dashboard. Do we have any questions at this point? Okay, if there's no specific questions, I think we finished up a little early.
As you start to digest the material, feel free to reach out. We're always here and happy to help. I know it takes a lot to kind of wrap your head around, and honestly, it's like when you start using things, then that's when you start to think of, oh, well, I'm having trouble with this, or this. So again, we are here and happy to serve you guys. So thank you for letting us present today.